What's Up, Doc? A show that we've been doing for well over a year now.
Yeah.
We spend some time with our friends at Mercy Health, experts in all sorts of different fields, and we always walk away having learned some valuable stuff. They walk away going, how did I get dragged into this?
Well, it's our returning guest, too. He wanted to do it twice.
So we obviously made somebody angry. They made him deal with us twice.
Doing it again.
I feel badly for him. His name is Dan DeSloover. We're going to talk about the Employee Assistance Program because he's the EAP coordinator. Dan, good morning.
Good morning to you. Thanks for having me on again. I do appreciate it.
It's a pleasure to have you with us. Tell us a little bit about you.
Well, I'm a mental health counselor. I've been in the business for a number of years, over 20 years, and currently in the Employee Assistance Program, as you mentioned, which just provides counseling for employees of Mercy Health and their household members.
Outstanding. We're going to talk a little bit about overcoming anxiety and worry. Joe and I wouldn't know anything about those sorts of things. I guess other people have that problem.
Right.
Now, everybody has that problem, don't they, Dan?
Well, I think so. I think we all worry from time to time. It's more of a question about how often and whether it starts to interfere in our life. When does it become a problem for us? That's the real question mark.
Yeah, are there physical cues if I'm just concerned about something, if I just general worry, or if this needs to be looked at? How do I know this has gone maybe a bridge too far? I need to go talk to somebody.
Yeah, if a person's experiencing an acute stressor and you're experiencing some physical symptoms, but that subsides in a short period of time, that's probably not too concerning. It's when anxiety or stress is elevated for a duration of time, because then that can start to lead to some health or emotional or mental health problems.
Dan, we often hear that, you'd be a lot healthier if you found a way to, get rid of that stress in your life. Try to get rid of that stress and anxiety. Well, that's one of those things that's so much easier said than done. And I don't know as I've ever met a human being who is stress-free.
Yeah, no, I haven't either. And certainly I experience stress or worry from time to time as well. But it is important to target anxiety, especially if it's on average, moderate or more, say 0 to 10 if it's, 5 or higher. That's an indicator that it's time to take a look at that. And, there are a couple different approaches to doing that. One would be to try to decrease the overall baseline of anxiety through behavioral strategies like exercise or recreation. But as you mentioned, there are other approaches too, like cognitive or thinking strategies that can be helpful to learn.
One of the other, I've done a little bit of research on this, and I like to play with mind stuff. And one of the best tips that I've ever received on reducing anxiety is just breathing exercises. If you feel a little stressed, just sitting and just thinking about your breathing for 30 seconds or whatever. It works for me, definitely. Is that something that you guys advise as well?
Oh, sure. I mean, that's a great go-to. That's a first line or a first step, is to focus on breathing, to regulate the breathing, so to try to prevent that shallow, rapid breathing or holding breath, and to have long exhales, and to do that a handful of times to bring that level of stress down, because it's easier to think and to problem solve and to plan after we're in a more relaxed state.
Does something physical happen to us when we take the deep breaths and think about it, or is it purely a mental thing?
Yeah, no, I think it's physical as well. Like, we just physically relax too. Our brains, our bodies are all interrelated, and so when we do that, not only does our anxiety come down, but our body relaxes as well.
It would seem also, I know that my grandmother was a woman who dealt with the depression throughout her entire life. Only they didn't call it that. They would call it the blues. They would call it that. And of course, a common strategy was, well, feel better, or have a drink, or shake it off, that sort of thing. But my grandmother's go-to, because I remember saying to her, what do you do when you're feeling down and you try to get yourself out of it? She says, I think of Bing Crosby. And what do you mean you think of Bing Crosby? In the movie White Christmas, I guess Bing Crosby sings a song about when you're worried, you can't sleep, you're anxious. Count your blessings instead of sheep, and, you'll fall asleep, so on and so forth. And she was always a big believer in perspective making and counting your blessings as a way to pull herself out of doldrums.
Yeah, that sounds like that could be a useful strategy. It reminds me of gratitude, and reflecting on the things we do have going right for ourselves in life can be helpful for improving mood. And I agree with you too that our thinking plays a critical role in how we feel, not just with mood but also with worry. And we know that for example, with anxiety or worry in particular, it's when we don't know how something's going to go, like the direction of something, and then we start making these fearful predictions.
And isn't part of it also weaning out the stuff that we know, okay, I'm stressing out over this. I have absolutely no control. This is out of my hands, I guess, and recognizing the difference over things that we should stress out because we can do something about and those we can't.
Yeah, I know. It's easy to forget that's an important strategy, is to ask ourselves, do I really have control over this? For example, we have limited control over what other people do, very little influence there. And so that's a really helpful strategy to ask oneself, do I have control over this? And if not, how do I best want to respond to it?
How long have you been in the mental health realm, practicing or studying?
Well, around 21 years or so.
We hear a lot about mental health awareness, and the stigma has definitely lessened in the last. It's still there, but it's lessened. What changes have you seen at the practice level? More diagnosis? Are you seeing just the increase of more people coming in and kind of at least knowing what they're talking about, or knowing that there is maybe a problem, they just don't know what it is yet?
Yeah, I have seen over the past 20 years a change in increased recognition of mental health symptoms and a decreased stigmatization of them. For example, people are much more aware about depression and anxiety and are willing to seek help for that or to start medication to help with those symptoms as well.
You bring up medication. How often, what percentage of the time is medication brought into the wellness plan for somebody with anxiety?
Well, really that's a good conversation for someone to have with their physician about whether medication might be indicated for anxiety or depression. But, as a general rule, if somebody's experiencing moderate to more symptoms, it certainly wouldn't hurt to visit with a primary care doc to evaluate the medication options. That provider would be in the best position to know whether medication would be indicated. But it's helpful to consider that, because that's an additional effective route for symptoms.
And I would imagine that this last year, in dealing with everything with the pandemic, the amount of people you talk to, the people you're seeing who have anxiety, and in some cases it's going off the charts, has to be bigger than you've ever seen before.
Well, yeah, you're right, and that's true. And in some of the national surveys, recently I was reviewing one from the CDC, reported about a threefold increase in anxiety and depression compared to the year before in 2019. So in 2020, there was a threefold increase. And the challenge with the pandemic was it wasn't just an acute stressor. It's been a chronic stressor, and trying to sustain that level of stress is very difficult. It's fatiguing, and it wears us down.
If somebody thinks they have a problem and you need to talk to somebody, are you the first stop along the way? Is it primary along the way? Is there another number? How do you start the conversation?
I would choose both of those routes. First, you could consult with a behavioral health provider, a counselor. And the easiest way to do that is to contact one's insurance company to find out who the local covered providers are, or to contact the physician for a medication evaluation and to review symptoms to help determine whether the symptoms rise to a level where it'd be important to get some counseling support.
And Joe had mentioned the stigma that at one time was heavily attached to issues dealing with mental health. That has lessened to a certain degree. What do you say to someone who's sitting on that fence, that in their mind, if I take this step and I reach out for help because of something going on upstairs, I don't know if I'm ever going to be able to walk out from under this stigma. What's this going to do to me? How do you respond to someone who has that concern?
Yeah, because that is challenging, because nobody wants to be judged, and certainly behavioral health providers are not in the business of judging people. They're in the business of being supportive. And the truth is, most people at some point in their life experience some mental health symptoms. And so it's a normal experience at some point in life to experience something, and it's really a sign of strength and courage to reach out for help.
What do you say to somebody that does initiate the conversation with somebody in the medical profession, but the meeting or the consultation doesn't go necessarily the way they want it to? They leave, unhappy. Seek somewhere else? Should you confront your medical provider? How do you reconcile that?
Well, if we're talking like a behavioral health provider, like a counselor, A couple things. One is, I might give it a few appointments to give it a chance to develop some rapport, and it's certainly appropriate as well to share any concerns with that counselor, so adjustments can be made in the process, so the person feels like it's more beneficial for them. So both of those strategies, saying something, and then also, giving a little bit of time to see about its helpfulness.
And is that, you say, say something to your provider, is that common that people, say, hey, this really isn't working for me, can we try a different angle, or is that happen less often than maybe it should?
Yeah, it's not as common, unfortunately, and it is really helpful when it does. It takes courage to be able to do that. And providers want to know about that because they want to meet clients' needs and provide the best possible care. And getting that information is helpful, so it's much appreciated by the provider.
And as an indicator that your primary wants to know and others want to know, the fact that when you go in, at least it's been my experience last time when I go in for my physicals or whatever else, part of the questionnaire is depression-based. How you been feeling? Have you been depressed? Have you been this? Have you been that? And, it's one of those, I'm here for a sprained finger. Yeah, I know, but we ask you this ahead of time. That would indicate to me that they really do want to know.
That's exactly right. It's a prioritization of mental health as well as physical health, as you mentioned, for screening for depressive and other symptoms. And so that helps with the normalization of seeking help for emotional concerns.
Before we let you go, we talked about, getting out exercises, doing some breathing exercises, concentrate on your breath. Anything else somebody can do, sit in their office to maybe alleviate some mental stresses?
Yeah, those physical strategies are helpful. In terms of thinking strategies, oftentimes we worry about things that are unlikely to happen, and a more helpful approach then is to use positive thinking when that outcome is actually warranted. Sometimes also a problem-solving approach is more helpful than ruminating or dwelling on a problem, or maybe even setting aside some time each day to think about problems, to kind of line them up and have a problem-solving, thinking about what you're going to do about each of those can be helpful to decrease rumination throughout the day.
All right. He's Dan DeSloover. He's Employee Assistance Program Coordinator, mental health professional with Mercy Health, and a second-time visitor on What's Up, Doc. What do you think? If they ask you to come on with us again, would you do it, Dan?
Well, I always enjoy talking with you all.
Wow.
We appreciate you taking time out of what we know is a very busy day, Dan. Thanks so much. Have a great rest of your week.
Yeah, thanks. Likewise. Same to you.
There we go. That's Dan DeSloover with Mercy Health.